Welcome to the Fabulous 50s and Beyond. I'm Jim Pollard, co-host with my wife Jeanetta. We have a very interesting show today, and this one deals with hearing. We've never done a show on hearing before, and we decided we needed to do that. And our guest today is Mike Stone, and he's from Stone Lang Hearing Rehabilitation. He's the owner, and we're excited about our show today, and we're going to learn a lot, I hope. You stay tuned, and we'll be right back.
And he'd say, go with what you got. Start from where you are. Give it your best shot. Keep reaching for that star. Get in the race. Keep your own pace. Keep moving and never stop. Just go. Go with what you got.
Welcome back. I'm Jim Pollard, your co-host with my wife Jeanetta. Our guest today is Mike Stone. Mike, good to have you with us today. This is a topic that as I have gotten older and older, it's one that I realized that we needed to be talking about. And as I was talking earlier, I have noticed that, and again, I think they call it background noises, I begin to eating into my hearing on some things also. But it's a problem that a lot of people have as they get older, right?
That is absolutely correct.
Now, my wife and I were talking about earlier that they're young kids that have problems, but it seems it's kind of like as we got older and things begin to bother us, we'd go to the internet and try to find a diagnosis or find out what it was. And one of the first things that always in the first paragraph, it would say that you can find it a lot of times in older people. And I said, well, we fit that. But on that line, at what age or when does someone begin to notice a hearing loss?
Well, hearing impairment is one of the most common physical impairments that we deal with as Americans, and it's very, very common. There are about 30 million Americans. About 1 out of every 10 Americans has some measurable hearing loss. And Jim and Jeanetta, it's absolutely true. As we get older, we begin to notice that we don't see quite as well as we once did, and we don't hear quite as well as we once did. By the time we hit 50 or 60 years of age, there's probably a 50-50 chance that we're going to have some hearing loss. And it's just very, very common.
Is there anything that you can do to prevent it? I know they say loud music and all, these earphones and all these things tend to increase the loss. Is there anything that, let's say, is there anything that after 50 you can do to help it?
Well, as far as preventing hearing loss, absolutely there are things that you can do to prevent loss. If you work in a noisy environment, or if you like to target shoot or skeet shoot, yes, you should wear ear protection. That's one of the main things that you can do. But many, many times, if you acquire hearing loss, it's either due to the natural aging process or, it's due to genetics. It's going to happen.
Once you've lost it, can you recover it, or is it become mechanical to recover?
Well, it depends upon the type of hearing loss. There are different types of hearing loss. Conductive hearing loss, sensory neural hearing loss are the two primary types of loss that we talk about. About 5% of the folks with hearing problems have conductive hearing loss, and about 90 to 95% of the hearing loss that we encounter is sensory neural loss.
Go ahead.
I'm going to ask a question that I know that everybody's interested in. Is there any government agency or anything that helps you with hearing problems?
As far as going to the doctor and determining what the cause of your impairment is, yes, the government does help with situations like that. Now, as far as the purchase of a hearing aid, that is not covered by Medicare. It is a private pay situation. And fortunately, there are hearing aids available today that are very high tech and they're very modestly priced. So if a person suspects hearing loss, they shouldn't allow that to discourage them. They should, have their hearing tested and investigate possible solutions, because a lot of your hearing aids that are available today are very, very reasonably priced.
But there are a lot of different ones that are available.
Absolutely, yeah.
What are some of the differences in the different hearing aids?
Well, there are different types of hearing aids available. depending upon the patient's hearing loss. Let's go back to your earlier question, types of hearing loss. Conductive hearing loss, what we're talking about here is we're talking about something that is blocking the sound out. When we have a patient with a purely conductive hearing loss, what we're saying is that the cochlea or the hearing nerve is functioning normally, but the sound is not being transmitted through the ear to the cochlea, to the hearing nerve. And some of the things that can cause that are something as simple as earwax in the ear canal, damage to the eardrum, such as a perforation or a thickening of the eardrum, damage to the ossicular chain, the three smallest bones in our body, the malleus, incus, and the stapes, or fluid in the middle ear. Fluid in the middle ear, otitis media, that's the most common type of conductive hearing loss that we encounter. Okay? And again, the important thing to remember about these conductive hearing problems is that they are frequently medically treatable or correctable. Unfortunately, only about 5% of the folks with hearing loss have conductive hearing problems. For the other 90-95% of the people, they have permanent sensory neural loss. And the reason I say that it's permanent is because surgery or medicine does not typically correct a sensory neural hearing loss. So what causes that? There are many things that can cause sensory neural hearing loss. The natural aging process, drug ototoxicity, hereditary factors. If you work in a noisy environment or if you are exposed to loud noises like shooting a gun, for example, this can cause permanent hearing loss. And typically what happens there, in the inner ear there is a snail-like object. It kind of looks like a snail. We call it the cochlea. And we are born with about 12 to 15,000 little hair cells in that cochlea. And over the course of our lifetime, those hair cells can be damaged, either due to illness, noise exposure, or again, just due to the natural aging process. But think of the hair cells in the cochlea as a forest of trees. Tornado comes down through that forest and knocks down some of those trees. Once they're damaged or once they die, they don't grow back. We've lost them forever. So hearing loss is cumulative. And so you want to protect the hearing that you've got, because once you damage those hair cells in the inner ear, they're gone. So when we have sensory neural hearing loss, unfortunately, most people, or fortunately, most people can be helped. But it just depends upon how severe the damage is. And you talked about not being able to understand at times, particularly in the presence of background noise. What happens there is we do not always lose our acuity for different frequencies at the same rate. Many people can hear low frequencies or vowel sounds, but they can't hear high frequencies, consonant sounds. And so this person would complain that people are mumbling. I'm just not hearing clearly, okay?
Yeah, I've been there.
Yeah.
So the vowels and the consonants have different frequencies then?
That's correct. Yeah.
That's interesting.
Yeah.
Like I say, I learn a lot on this program myself. So, but and are your devices all electronic? I mean, your testing is done electronically?
Well, yes. I mean, we use a piece of equipment called an audiometer. And the audiometer enables us to test a person's hearing at different frequencies and measure the person's hearing acuity at each frequency. So we actually plot that on a graph.
So you can actually do that then?
We can actually do that. Yes, we can.
The sounds.
Yeah.
Is it picked up electronically, or is it done mechanically with the person's responses?
Well, I mean, it's a subjective response. You know, typically what we do is we ask the patient to push a button or raise their hand when they hear the tone. Now, when you're testing small children, babies, for example, you can't count on them to subjectively respond. So there is equipment, there are ways to measure a child or a baby's hearing without them actually participating. It's not quite as accurate, but nevertheless you get a good rough guesstimation as to how much loss that child might have.
Go ahead.
I started to say, you can first tell about a baby, like if there's a loud noise and they don't react at all. Then you begin to think that maybe that child cannot hear. Right? Is that true?
I worked with a parent just last week, and she told me that her child, they never suspected that the child had hearing loss until the child was screened in school. And that's when they determined that the child did indeed have hearing loss in one ear.
Never thought about it.
Well, I mean,
never knew.
This child did not report to its parents that it was not hearing in one ear. It was just going ahead with life, hearing out of one ear.
Well, he probably didn't know any different, because
Well,
if that's what you've heard all your life, then you
Exactly.
don't know that you don't hear the same thing.
Exactly.
Because I've had my eyes, I had crossed eyes, and
she learned to use one eye.
right, and it doesn't make it. I see fine, but compared to you, if you had my eyes, you probably would not see fine.
Correct.
Yeah.
Yeah.
So well, that's interesting how that works, and with the children especially. Cochlear implants. I think we're not going to have time to really talk about them much in this time for the show, but how long have they been around?
Cochlear implants have been around for quite a long time. I believe it was the House Ear Institute out in Los Angeles that did some of the early work with cochlear implants, and that was 20 or 30 years ago, a long time ago. We're into many generations of cochlear implants, and I'm glad you mentioned that, Jim, because I do have people that come in my office and they ask me, hey, how about a cochlear implant? Am I a candidate for a cochlear implant? The important thing to know here is cochlear implants are indicated for patients that cannot utilize a hearing aid. If you have partial hearing loss, even a severe loss, and you can wear a hearing aid, that would be the way to go. A cochlear implant would be indicated when a person is totally deaf or nearly deaf. In other words, if a hearing aid just will not work. The reason for that is cochlear implants are very, very expensive. Cochlear implants are surgically implanted. It is an invasive procedure, it is something that you would only want to consider if you're deaf, okay, or nearly deaf. If a hearing aid will work, that's really the route to go.
Speaking of hearing aids, I'm going to assume something here. You can correct me if I'm wrong. I would think that one of the big problems with people in hearing aids in the past has been the stigma of wearing one.
It certainly has been for a lot of folks, but hearing aids have become so small, so tiny, so inconspicuous. I have patients that tell me I've been wearing hearing aids for months or even years, and my friends, I pulled my hearing aid out of my ear to change the battery the other day. We were playing cards, and my friend said, well, I didn't know you wore a hearing aid. I mean, they're just so small that people don't even see them or notice them today. So if that's a person's concern, they should push that aside, because they're really quite small and inconspicuous and comfortable to wear.
And I guess they had the more of a stigma problem than eyeglasses did, because glasses, it's no different than needing glasses than it is needing a hearing aid, is it?
Well, Jim, I call hearing aids, or I call hearing loss, the silent thief, because for most folks it sneaks up on you. You can't see it, you don't feel it. Usually it is a family member or a friend that will call your attention to it. They will tell you, gee, you've got the television turned really loud, or you notice that you're having to ask people to repeat. Or you're complaining that voices just don't seem clear. I hear fine, but Jeanetta mumbles all the time, okay? And the rest of us know that Jeanetta doesn't mumble, it's just that your hearing has been affected by hearing loss.
Well, and I never thought of it that way either, but the silent, what'd you call it, the silent?
I call it the silent thief. It
the
sneaks
silent
up on
thief.
you.
Yeah, it sneaks up on you. That's
yes,
good.
It does.
Okay, we're through with the first type, and again, this has been a very interesting show. I mean, a lot of things I'm learning, and I hope our audience is learning too. So you stay tuned, and we'll be right back and discuss hearing loss again.
We didn't have much to give then. So when they showed up firing them mean looks around the place and staring us down on prices, well, I was angry. Didn't seem to bother my father, though. He had me load another bushel of apples in their trunk. I learned later on that this family was in need.
The greatest gift we give, it's in our heart, what we believe, the way we live.
Caring for others. Pass it on.
And he'd say, go with what you got. Start from where you are. Give it your best shot. Keep reaching for that star. Get in the race, keep your own pace, keep moving and never stop. Just go, go with what you got.
Welcome back. I'm Jim Pollard, co-host with my wife Jeanetta, and our guest today is Mike Stone, and we're talking about hearing impairments and what you can do to overcome them, what causes them, where they come from, and just a lot of questions that we need answering, and he's answering them very fine for us. Mike, good to have you with us again
Thanks
today.
again, Jim, Jeanetta.
And again, we're glad, as I said, we just had not covered this subject, and it's a very important subject for our over 50 group, as we call them. And I think Jeanetta's got a question there for you.
What are some of the ways that one might overcome hearing loss?
Well, that's a good question, Jeanetta. It really depends upon what type of hearing loss that you have. And earlier I mentioned the fact that there are two types of hearing loss. Conductive loss and sensory neural loss are the two primary types that we talk about. And by the way, it's possible to have what we call a mixed hearing loss. That's a combination of conductive and sensory neural loss. Conductive loss, once again, could be something as simple as earwax in your ear canal or fluid in the middle ear. So if you have a conductive hearing loss, that can frequently be helped by medical intervention, okay? The wax can be removed, or a physician can give you antibiotics and medication to clear up the fluid in the middle ear. So for conductive hearing loss, that would be the proper course of action. For the other 95% of people with hearing loss, sensory neural loss, a hearing aid would be the thing that you should do to try to correct your hearing. And not everyone can be helped, but the vast majority of people are going to receive anywhere from moderate to excellent improvement from amplification. Okay?
Okay, I'm going to ask another question.
Sure.
Wax in the ear.
Mm-hmm.
Now, our son had problems when he was younger,
Mm-hmm.
and we took him to the doctor, and they told him, don't ever put anything smaller than an elbow in your ear.
Okay.
So how do you get the wax out?
Okay. Well, some folks have a lot of wax production in their ears, and other people just have very, very little wax production. But earwax is secreted in the outer 1/3 of your ear canal. So if you leave it alone, it's fairly easy to get out. You can either have your hearing healthcare professional remove it, or you can irrigate it and flush it out with an ear syringe, okay? When a patient comes in my office and I see earwax pushed way back up in the ear canal, up against the eardrum, I know that they've been digging around their ear with a Q-tip, and they've pushed that wax way back in their ear. Then it's a little more challenging to remove it, and not quite as comfortable to remove it. So your best bet is to not go in your ear with a Q-tip and try to remove it yourself, because you're probably just going to push it back in your ear. And not only that, but the epithelial tissue lining in your ear canal is very tender. You can irritate and actually tear the skin in your ear canal by digging around with a Q-tip. And you don't want to cause an infection in your ear canal.
Even what is it that happens? I mean, I hear people, of course, they get they call it get their ears irrigated. Is that what I'm saying?
Irrigation. Mm-hmm.
Is that for wax removal?
Mm-hmm. Correct.
That's what that's for.
Right.
I know kids
and
have it.
if you do irrigate your ear with a syringe, don't use hot or cold water. Use just lukewarm body temperature water.
Okay.
And as a final rinse, while we're on that topic, as a final rinse, it's not a bad idea to use a little white vinegar and rubbing alcohol, 50-50 mixture, and the alcohol dries the ear out, kills bacteria. The vinegar restores the pH balance in your ear.
Oh, really?
Mm-hmm.
We have these books, you know, vinegar cures, and man, you read that thing and use vinegar for everything, can't you?
Vinegar cures everything, according to them.
What is it when a person has their ears drained?
Well, are you talking about a fluid in the middle ear?
I guess that's what I'm talking about.
Okay. The middle ear space is ventilated by the eustachian tube, which drains into the nasopharynx, drains into our throat, okay? And if the eustachian tube is closed due to a cold or an allergy, then we get a vacuum in our middle ear. And as that vacuum persists, fluid begins to seep in and drain in the middle ear space. If that fluid accumulates to a certain point, it begins to affect our hearing. You can have just fluid in your middle ear. It can be sterile, no infection, or you can have an infection in there. When you get an infection, you're going to know about it because it's going to be very uncomfortable. And so when a person presents to their doctor's office and they have a middle ear infection, they're probably going to give them antibiotics, and medication would be the first course of action. If it persists long enough, they may make a little incision in the eardrum. We call it a myringotomy, and they may place a little tube in the eardrum. It's called a PE tube, or a pressure equalization tube. And they leave that in there until the infection clears up so that we can equalize the air pressure in the middle ear. That PE tube typically will fall out of the eardrum, and you may wake up some morning with it laying on your pillow.
So it just kind of takes care of itself then.
It kind of takes care of itself.
Is this more that likely to happen in children than adults?
80% of all children have ear infections by the time they're 2 years old. It's just part of growing up, but they typically grow out of it. So as a parent, just know that the chances are your children are going to grow out of those middle ear infections when they get a little older.
Okay, another term, vertigo.
Vertigo? Mm-hmm.
What is it, and what happens to cause it? 'Cause it's if I correct, you get dizzy, right?
Yes, vertigo.
Sense of direction.
Vertigo is dizziness, and there are a lot of things that can cause vertigo, but certainly problems associated with the ear can cause vertigo. If you had a foreign object in your ear canal touching the eardrum, just that foreign object touching the eardrum could cause vertigo.
Really?
Fluid in the middle ear could cause vertigo. There are viruses that can cause vertigo. So many things can cause it.
Well, is it primarily caused by something with the ear?
Well, again, it can be, but not always. There are just many things that can cause vertigo besides just ear problems. But our nerve of balance is housed in the semicircular canals, and the nerve of balance, anatomically, it functions very similar to the hearing nerve. They're actually located right next to each other, and they're actually physically connected to each other. So because they look and function very similar, a lot of times when we have hearing problems, we sometimes can have dizziness or vertigo.
Well, that answers another question. You know, that's another thing. Well, we talked about hearing aids and things a while ago. What are the different types or different brands of hearing aids, and is there a difference?
Okay. I'm going to tell you this. There is no one best brand of hearing aid. I work with a lot of different hearing aid manufacturers. There are a lot of good brands out there. That doesn't mean that they're all the same. That doesn't mean they're all made the same or they work the same. A surgeon may have a particular type of scalpel that he likes to use, and another surgeon may prefer a different scalpel. Same thing with hearing healthcare professionals. I have certain brands of hearing aids. I like the way they perform. I like the way that they're put together and the way they hold up. So they're not all the same, but there are many good brands out there. And different types of hearing aids that are available today. So really the important thing is not so much the brand, but it's the professional that you're working with, selecting a hearing healthcare professional that you trust and that is knowledgeable and that you know is in a position to take good care of you and give you the service that you need.
I think the size has a lot to do with it, because people have their pride, and they don't want people to know that they're having a hearing aid.
Yeah, well, that's a good point, and why don't we talk about some different types of hearing aids? I mean, again, as I pointed out a few moments ago, for 90 to 95% of the folks with hearing problems, amplification or a hearing aid is the only solution, if it will help. And so what a person should do is have their hearing evaluated, go to your hearing healthcare professional, have your hearing evaluated, find out if a hearing aid is indicated, and if it is, in the state of Kentucky, hearing aids are fit on a 30-day trial. You've got 30 days to wear it, make sure you're pleased with it. If it doesn't work, you can always take it back and return it. So let's talk a little bit about some different types of hearing aids, okay?
Okay.
Some hearing aids fit in the ear canal. And here's an example of one that fills up the ear, okay? It's a little bit larger. But it's very comfortable to wear, and this hearing aid is an excellent choice with someone that has a severe hearing loss, okay? Because we can get a lot of power and really good battery life out of this hearing aid, okay? And then I'll jump to a smaller hearing aid. This is what we call a completely in the canal hearing aid. It fits down deep in the ear canal and it is practically invisible. This is a hearing aid that just doesn't show. This is the one that your friends probably won't know you're wearing. And the lion's share of folks with hearing loss can wear this hearing aid.
Now, price-wise, are they, you don't have to give any particular, but are some of them quite a bit more expensive than others?
Good question. Some hearing aids are just a few $100s. Some hearing aids may be $2,000 or $3,000. So they can vary anywhere from a few hundred to $2,000 or $3,000, depending upon the brand and the technology, how sophisticated the technology is. Jeanetta, if you want just a ballpark idea how much a person might have to spend, somewhere from a few $100s to a couple $1,000s, you can get some wonderful, wonderful hearing aid technology. Okay? So these are in-the-ear hearing aids. We also have behind-the-ear hearing aids, and I've got a couple here that I'll show you. This behind-the-ear or post-auricular hearing aid has a mold that is custom-made to fit the patient's ear, and we can fit anywhere from a mild loss to a very, very severe hearing loss with this hearing aid. Okay? And as you can see, they can be very, very small, very, very comfortable. And they fit behind the ear, and they don't show much at all either. Right. Particularly if your hair is down over your ear. It just doesn't show.
All right, Mike, again, thank you for being with us today. We've learned a lot, and we hope our people have learned a lot too. And we want to thank you for being with us today also. We want to remind you that we're here every week, and you come back next week, we'll have another show and another topic. And remember our motto, use it or lose it.
Can't see as well as I used to, can't run as far or as fast. Sometimes I think that the old me is becoming exactly that. But when I start thinking of all I don't have, that's when I tell poor me Beethoven was 50 and deaf as a post when he wrote his Ninth Symphony. And he'd say, go with what you got, start from where you are, give it your best shot, keep reaching for that star.